Okay, hello everyone. This is Brittany Cadence, the Communications Manager at Peterborough Public Health. Thank you very much for joining us today for this special update to the community regarding the Severn Court outbreak and public health measures. We are very pleased to have our board chair, Mayor Andy Mitchell, joining us, and Dr. Rosanna Salvaterra, Medical Officer of Health, who will be providing some important information about those two topics. We won't go through our usual slides that we do during these briefings on COVID statistics. That we will save for Thursday. I would also just like to note that Dr. Salvaterra has another meeting at 12:45, so we'll need to wrap this up by that time. And just a reminder to please keep your mics muted until you're called on to speak. After Dr. Salvaterra's remarks, of course, I will open it up to our media partners. I'll work through the list of everyone I see here and invite you to offer your questions. So with that, I am going to move us along to our land acknowledgement. Just to take a moment to pause at this busy time. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, I would now like to invite our board chair, Mayor Andy Mitchell, to provide us with some opening remarks. Please go ahead, Andy.
Thank you, Brittany. I suspect that when folks gathered to party together at a student residence recently, they didn't believe they were placing anyone at risk. I imagine that their decision to ignore rules around masking, to disregard the need to physical distance, and to pay no attention to the importance of limiting indoor social gatherings didn't seem like a dangerous thing to do. Well, they were wrong. They were very wrong. And anyone who has taken similar risk is just as wrong. So what are the consequences? 34 new cases of COVID-19 in our community so far, and more are sure to come. Almost 200 close contacts needing to be traced and monitored. The spreading of variants of concern into the broader community. Sutherland campus of Fleming closed, disrupting 700 students' education. Placing at risk people they care about. Taking public health resources away from vaccine rollout. It doesn't stop there. If this outbreak requires an escalation in our threat level, it will mean more restrictions for all of us. More financial hardships for our business community, and new threats to people's jobs. A population weary of almost a year of pandemic will have to face one more round of hardships. No one means for this to happen. No one wants to place others at risk. No one wants to cause hardships for others. But please remember, our actions have consequences. I know the majority of people in our community, young and older, are doing the right thing. Thank you. We are appreciative of the quick efforts on the part of our partners like Fleming, Trent, Peterborough Paramedics, and Severn Court Property Management. But please, everyone remember, adhering to public health guidelines is essential to protecting ourselves, our families, and our community. So everyone, no indoor social gatherings. No dining at the same table in a restaurant with anyone other than those you live with. No forgetting to wear a mask when indoors and away from home. No disregarding physical distancing. No leaving home when you or a member of your household has a COVID-19 symptom. Our ability to control the pandemic requires a collective effort, one anchored in each of us taking personal responsibility for our individual actions. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Andy. Okay, so now I will invite Dr. Salvatierra, and I can put you up on the screen, Dr. Salvatierra, if you'd like, to provide us with an update on the outbreak. Go ahead.
Great, thanks, Brittany. Thank you, everyone, for joining us for another update on the outbreak at the Severn Court student residence. This has become the largest COVID-19 outbreak in our region since the pandemic began. As of 10 a.m. this morning, there were 34 confirmed cases, including 5 Trent students and 29 students from Fleming. Of these 34 cases, 3 have screened positive for variants of concern, and we are awaiting further results from the genomic sequencing to determine which variant. However, we are treating all cases and the more than 200 associated high-risk contacts as variants of concern. Our case and contact management team has been aggressively contact tracing, and thanks to the city county paramedics, they have been going into the rooms to test all high-risk contacts who are in self-isolation. Shortly, we expect to have surveillance testing in place at Severn Court for all residents who are subject of the stay-at-home order. As mentioned on Sunday, the Section 22 class order is to all residents at Severn Court. This order defines 2 groups and requires them to follow specific instructions. Group A consists of the known positive cases and high-risk contacts. They are required to stay in their rooms, no exceptions. Arrangements have been made to provide them with food and other necessities, and our public health nurses call them every day to check in on them and monitor symptoms. The other group, that I'll call Group B, refers to all the other residents who live there, and the order requires them to self-isolate and only leave their rooms to get food or medications. This group will also be tested by the paramedics once the surveillance testing has been set up on site. As we are witnessing, cases of variants of concern spread rapidly. So my team is implementing more public health measures in the community to try and prevent its spread. I am reminding all Peterborough residents, as has my board chair, to mask and to keep 2 meters of distance whenever they are away from home or with others who are not in their household. If they do go out to dine to a local food premise, they are to do so only with their household contacts. Since food premises were allowed to reopen on February 16th, we have become aware of situations where people were identified as close contacts of a case because they dined with others outside their household. Dining out in public is a high-risk activity for COVID-19 transmission, as it is not possible to maintain 2 meters of distance and masks cannot be worn while eating or drinking. As I have stated several times already, having businesses open does not mean the pandemic is over. There will come a time, hopefully in the next several months, when we can gather with friends again for a party or a meal, but this is not the time yet. Yet this evidence is why I have issued instructions to all food premises in the community, requiring them to ensure that all patrons attest that they are dining only with their household members. These instructions were shared with local businesses yesterday and will take effect this Friday, March the 5th. So be prepared. If you are heading out, and as you consider your plans for St. Patrick's Day, Easter, or the April school break, make your plans only with your household members and be prepared to attest that you are only socializing with them and that you do not have any COVID symptoms. Peterborough's vulnerable community members are counting on you to be responsible, as am I. Please remember, we all share this responsibility, and it is all that we have at the moment. Thank you.
Thank you very much, Dr. Salvatierra. Okay, so we now will move on to the opportunity for our media guests to answer some questions. And I'm going to go down the list alphabetically, if that's okay. So I will start with Dave Feely from Your TV. Did you have any questions for Dr. Salvatierra?
Hi, Doctor. How are you today? Thank you for hosting this special, unfortunate meeting. Will there be any charges forthcoming under the Act for this rather blatant defiance of the laws?
I haven't ruled that out. I think it will depend on the information we receive from our cases and contacts. We're getting more information as the days progress, and at some point we may have enough in order to ask the police to intervene.
Thank you very much.
Okay, thank you, Dave. Glad you could join us today. Joelle Kovac from the Examiner, please go ahead.
I think you're muted, Joelle.
Yep, sorry, I had to undock my machine in order to unmute. Okay, so, oh my goodness. Okay, can you tell me a little bit about how the new pilot project to start testing the provincial system for booking appointments is going? You were saying that you're starting with the staff at 2 retirement homes where vaccination will take place this Friday. For instance, do we know, can you say which retirement homes those are, or how many people are going to be testing out that system, or?
Well, I can say that there's about 200 people who are going to help us with the pilot. They are all staff at these retirement homes. They're not the residents. The residents will be immunized too at the same time, but we're only testing this with using the staff because when we asked, the residents didn't have email addresses. And in order to activate the booking system, you need to have an email address. So we're good to go. We have the city staff are assisting us with staffing up the call center that will run alongside the provincial booking system so that people who either are unable to book using the link that they get or who need assistance can get that assistance from us. So we're trialing it out all week. The clinics are scheduled for the end of the week, and we'll have a better sense then of how this is working and whether it's going to be good to go on March 15th, which is when the province would like to launch it.
Okay, that's great. Has the last shipments of vaccine that has been received all been administered at this point, or not?
We are administering lots of vaccine. I don't personally hold the vaccine in my custody. It's PRHC has the vaccine, and we could get that information to you, Joelle. We do keep track of how much has been received and how much has been used. I know we are actually hoping to get more because we need more. We are opening up the vaccination to our First Nations, our urban Indigenous, all of our seniors congregate settings, and we'd like to have this available, enough vaccine available the week of March 15th to be able to do all of our over 80s and over in the following week. So I have sent some emails asking for a vaccine, and I am making plans to ensure that we have enough vaccine to do our 80 plus.
Okay, is the because you were saying that one type is a monthly shipment and one type is a weekly, right? Is there a pause on that weekly shipment for this week?
No, we're getting vaccine every week. Every week we're getting some vaccine, and it's being distributed to as fairly as possible. But because we were one of the last health units to get vaccine, we have a bit of catching up to do.
Okay, and my last question is there a plan for vaccinating people who are experiencing homelessness? Because I've heard that they've been pushed up as a priority group.
Several medical officers of health have identified that they have ongoing outbreaks in the shelter system for people who are underhoused or homeless. So that group has been highlighted as a group that needs to be immunized. So we certainly are having conversations about our own homeless population here in Peterborough. I'm not sure where we've landed. I'm very hopeful with the new AstraZeneca vaccine, which is much more mobile and can be taken out into the community. I'm hoping that we might get some of that, and that potentially could put it to good use in some of these high-risk groups, such as the underhoused group.
Okay, that's great. I'm going to stop.
Okay, thank you very much, Joelle. Okay, so moving down alphabetically, we have Mark Junta from Global News. If you've got some questions, go right ahead.
Yes, hello. Just wondering, through your investigation, have we determined just how big this gathering was at Severn Court residence?
It's still not completely clear, Mark. We're getting some reports that there were actually several parties in several of the buildings. I'm not sure what is accurate and what is just hearsay. We're trying to sort that out as we continue our investigations.
There we go. Just in terms of pending results, how many pending tests are there out there? Do we know at this point?
I don't know, but given the number of high-risk contacts, with this being a variant of concern, the current provincial guidance is that you test all high-risk contacts twice. You test them as soon as they've been identified as a high-risk contact, and then you test them again after the 7th day. So just consider we have about 200 high-risk contacts. They will all be tested twice. And that does not include the other residents of the building who are being voluntarily tested. They can choose to be tested, and we are encouraging them to be tested. So I would hazard a guess that we have a large number of results that are still pending. And I know we are receiving results constantly because our numbers continue to change from hour to hour.
I know with college and university students, a lot of them, because they don't live here permanently, they're here 8 months of the year, they oftentimes will not change their residence where they actually live. So, you know, they might say Toronto on their ID. The folks that are testing positive, are they counting towards our local numbers, or do they count towards where they actually live?
So it's a little of both. Because they're being tested locally and it's my name on the testing requisition, I get the results and we count them as ours. What's happened, and we have 3 cases so far where the parents have asked for the case to go home and complete their quarantine at home. And in those 3 cases, we have transferred the case and the follow-up to the local public health agency. So we've done a warm handoff of the case and are quite confident that they are being followed up appropriately by our colleagues in public health. So the numbers will vary because of that, Mark. We will count them initially here, and as long as they are with us, they continue to count. And if they are transferring home, those numbers will then be subtracted from our total numbers and will be added to their home cumulative totals.
Just wondering, in terms of enforcement, to enforce your order, how will we be enforcing that? Are we checking in? Are we sending people to check in? How does that work?
So we have all of the cases and high-risk contacts are being followed daily by us. So we are doing that kind of check-in, and if we have any concern about compliance, we have been in discussion with the property managers at Severn Court. They have stepped up their security, and so we're relying on their security to assist us.
Final one, I promise. Is there still concern that this could lead to a very, very large outbreak in terms of hundreds of cases and a possible zone color change for the region?
Yes, I think that is still a possibility, and only time will tell. Hard to predict. I mean, it's always, is this the tip of the iceberg? That's my worry. What are we seeing, and how much of the true outbreak does it represent? And we will only know that as more people are tested and more results obtained.
All right, thank you very much.
You're welcome.
Great, thank you very much, Mark. Okay, now Matt Latour from our partner radio stations, Freak and Oldies. Go ahead, Matt.
I know you mentioned that there is voluntary testing for some of the residents, and I know that the Severn Court holds almost 370 residents. Do you know how many are currently staying there?
The number I've been given is about 200.
Perfect. And I know you mentioned off the top that 5 Trent students have also contracted the virus as a result of this outbreak. Are they Trent students that live at Severn Court, or do they live elsewhere and were visiting?
I believe they were visiting, Matt, and I know they're being quarantined in a special residence just for them. So they're isolating and being supervised during that isolation.
Perfect. That's it for me. Thank you.
Okay, great. Thank you, Matt. So Paul Rellinger from Kawartha Now, if you've got some questions, go right ahead, Paul.
I do, Brittany. Thank you, Dr. Salvatierra. Just a clarification, if I could. First of all, there's been 34 cases. You mentioned 3 have been kind of handed off to other health units. So does that mean there was 37, or are those 3 part of the 34?
No, I believe those 3 count in our 34, Paul, but you may not see them contribute to our cumulative total or our active cases that we are currently following. So the numbers are not going to match for the next little while, especially with this outbreak, because unlike a long-term care home or a hospital where people stay in their beds, we have a very mobile population, and we have parents who are very keen to come and collect their son or daughter and bring them home.
Okay, perfect. Thank you. And I know you've answered this, but I'm just looking for clarification a little bit more, if I could, regarding the subject of any possible fines resulting from the outbreak. And you know this as well as I do. There's been tons of Facebook chatter. People are actually angry that they're following rules at home, doing all they need to do. This goes on, and there's no repercussions, at least at this point. You can kind of understand their frustration and anger. Can you give us some idea what like, I know you said an investigation is ongoing, but would it not be fairly clear cut who organized this party, or could that information not be found out, rather simply, you would think?
Once we have enough consistent information, Paul, we can in fact ask the police to investigate and follow up with laying charges under the Reopening of Ontario Act. As you can well imagine, with this many people, we are getting lots of conflicting information. I just want to also point out that although I am disappointed and can sometimes feel angry as well, especially when I read some of the social media posts, these students are not typical of the students of Fleming and Trent. The majority of students, I believe, have been very responsible, and this is really the actions of a few. And if we can identify the people who were responsible for hosting the party, we do have the tools to take action, and we will not hesitate.
Would you agree, Dr. Salvatierra, that rules without enforcement are, you know, they're basically, I don't want to use the term toothless, but you know, it doesn't send the right message.
Well, I believe that in order to change behavior, you need more than education, and there's a role for enforcement. And so, given we're in a year into this pandemic, Paul, I agree with you that it is that really the time is for enforcement.
Just a couple more questions, and thank you for that. Regarding your instructions to restaurants, I think you used the term instructions. Can I ask under what authority those instructions are backed? Is it a Section 22 order, or how are you able to issue instructions that are enforceable?
So those instructions are issued under the Reopening of Ontario Act, and that makes them enforceable.
So that's written right into the act?
Yes, it is.
Okay, thank you. I should probably read the act, right? I appreciate that. And I had one other question. Oh yeah, going back to the outbreak again. Sorry, I'm jumping all over the place, but it was the parties were on February 20th. I believe the first case was detected February 25th, which was last Thursday. If I remember.
Last Thursday, we had our first case.
What's the level of your concern regarding what happened between the 20th and that first case being detected? I think we can make the assumption that of that large number of people, at least some of them were out and about in the public and doing things and were infected at that time.
Correct. And what we know about the variants of concern is that their incubation period tends to be shorter, which means people would have become infectious sooner and before they had symptoms. So I agree with you. I'm very concerned about what happened between February 20th and the 25th. And we could have had a lot of spread occurring before people were even aware, which is why it's important for anyone in Peterborough to make sure you screen every day, monitor for symptoms. If you do have any symptoms, even if they're mild, to isolate yourself immediately and to get tested. We have really good access to testing here in Peterborough, both at the Northcrest site and also at the PRHC Assessment Center. I believe we are seeing more people going for testing, which is a great sign. I just have to reinforce that everyone needs to be aware and needs to take action as soon as possible. The sooner we can isolate and confirm that we're a case, the sooner we can try to shut this down.
Would it be a good assumption or a safe assumption, Dr. Salvatierra, that that period between party and first case detected would be, in your mind, the area of concern in terms of future cases related to this particular incident?
Sure, that is one of the reasons why I'm afraid that this outbreak may be difficult to control for us, both that time before we became aware, but also the ongoing infection that might be out there, Paul, that people are transmitting the disease are ignoring symptoms because they're mild, are not even aware that they have COVID and are passing it on. It doesn't take long for this to get passed on to a vulnerable member of our community. And we know that over the age of 65, people become much at greater risk for hospitalization and for serious illness and for death. And that's the group that we are trying to protect until we have immunizations available for them.
Thank you. And my last question, finally, I'm sorry for taking so long. It concerns the vaccine and healthcare providers. Cordenal has, I know of at least 3 cases where people have called their doctor. They may have a parent who's elderly and asked what's going on. When they live in their homes. They're not in a long-term care home setting. And they've been told in each case in different ways, we don't know. And I just want to get a handle for, like, how do you answer that? I mean, that's very frustrating for people looking to get their elderly parents vaccinated.
So I just did a healthcare provider advisory this morning, alerting all of our healthcare providers in Peterborough that we are beginning our communication campaign for the 80+ group, and advising healthcare providers that their over 80 population might be seeking their advice and their counseling in order to prepare for immunization. Certainly, people who are immunocompromised, for example, need to have a conversation with their physician about whether or not the vaccine's a good choice for them. We also need anyone who has a severe allergy to either other vaccines or to medications to have a conversation with their physician. There are ways in which we are attempting to get consultations with specialists, allergists, or immunologists in some rare cases, but also we have a different stream for those people through PRHC. So that has been set up. So we've sent that healthcare provider advisory has gone out today, and we are following it up. And I'm going to ask Brittany to respond to your question. Brittany, can you let Paul know a little bit about what we've got planned for our over 80 group in the next couple of weeks, please?
Certainly. So we actually have a news release that will be going out today that is giving our over 80 population something to do while they're waiting to be able to book their appointment through the provincial system. So as Dr. Salvatierra mentioned, those who are considered special populations, so if they have allergies to medicine or immunocompromised, for example, they can be reaching out to their healthcare providers now and asking to have a consultation about the COVID vaccine and whether it's right for them. The other thing they can do is promote or identify who can help them with the booking if they don't have an email address, or if using the computer poses any challenge. There will be a phone system that people can book appointments on as well. But if they need help, now is the time to identify who can help them do that. And we understand from the Ministry of Health that the online COVAX appointment booking system will be ready on March 15th. So that's when we hope to be able to open it up just for those people eligible, which means those who are over 80. So we do have more information coming, and our website actually has already been updated with some of this information. So that's part of our communication strategy, as well as we are embarking on an advertising campaign with our city and county partners, and we will continue to roll out messaging so everyone knows when they are eligible to book their appointment. So stay tuned for more, but we certainly do have some initial actions underway.
Thanks, Brittany.
Perfect. And Dr. Salvatierra, sorry, the students going back to the Severn Court, the students, is there any indication they were all, do we know what programs these students were in terms of, were they all nursing students? Were they all law students, is there any indication that one certain group of students was dominant?
We understand that there were students who were in the trades programs at Fleming and students who were in the healthcare worker faculty as well, which is very disappointing.
Like nursing students?
I'm unsure if it was not sure if it was nursing. I know it was PSWs for sure.
Mm-hmm. Okay, thank you, and I apologize to my media colleagues for taking a lot of your time.
Okay, thank you very much, Paul. I'm going to give our next two media a chance to ask their questions, and then I'll circle back to those who've raised their hands. So Taylor Clydesdale from Peterborough This Week, please go ahead.
Hi, thanks, Brittany. Yes, just in regards to, I feel like maybe it's semantics, but are we officially calling it a party at this point?
I don't think it matters, right? Social gathering, party. I think it's the same thing. People who were together who were not members of their households.
Okay, no worries. I'm just being a little bit anal about semantics, but I'm wondering if you might be able to outline. I'm just hearing that there might be problems with contact tracing because some students are being a bit secretive or not being as forthcoming as they should be. Is that the case? Can you explain that?
That's always the case, Taylor. I mean, we rely on people being honest and forthright with us. We understand that sometimes there are barriers that prevent or get in the way or make it hard for people to be honest with us. And what we often find is that over the period of the 14 days where our nurses are in contact with cases and with contacts, that sometimes as that relationship develops and that trust builds, that people will provide us with additional information. Unfortunately, with a variant of concern, we don't have a lot of time given how transmissible the variants are. But again, we are hoping that in the context of a therapeutic relationship with us, a relationship where we are working in their best interest to help them and help them stay safe, we hope that people will be honest with us.
Just seeing a lot of comments on social media. There's a lot of people posting a lot of different rumors, and we're just seeing some posts from people saying that the social gatherings haven't really stopped at Severn Court, that there have been other gatherings and guests being invited in. Are you hearing similar things? What is the surveillance of that residence showing you? That is there still gatherings taking place?
I'm not aware that there are. And we can certainly pass that on to, thank you for sharing. We'll pass that on to our case and contact management team. I know we are working very closely with the security at that building, so we can pass that on.
Okay. Just, I know one of our other media had asked about the potential to be put into the orange zone. What is the threshold for going from yellow into orange, and where are we right now?
Okay.
In terms of coming close to that threshold.
Yeah. So for orange, we need essentially, if we have a weekly incidence rate that's between 25 to 39.9, we would be in orange. If we have a weekly incidence rate of over 40, we would be in red. Depending also on the percent positivity of testing. Certainly if we are, once we get over 2.5% of our people testing positive, we are in red. Below that, it would be orange. And then what the reproductive rate is, how many people are being infected for every case. Once you're over 1.2, you're actually into red. what kind of capacity we have, both in the hospital system as well in public health. And that will be determined by the number of high-risk contacts we're having to follow and all the additional work. So I don't know yet where we'll land. We typically do our calculations on Wednesdays. So we'll have a better sense on tomorrow, and we will be sharing that with you on Thursday.
Okay, thank you, Dr. Salvatierra. I just know, restaurants are open, businesses are open, the stay-at-home order has been lifted, and yet we're seeing these concerning numbers, and we have this kind of the largest we've ever seen in Peterborough outbreak of this variant cases. Just because these things are open and accessible to the public, does that mean that people should be partaking right now? Would it be safest if people stayed home?
It's always safest if people stay home. And I know many do. I know many of our vulnerable population, they've been at home since last March. And that's the safest place for them to stay. If you do go out, you have to use all of the public health measures. And we know that our businesses are compliant for the most part. We certainly work very closely with them to ensure that they're following all of the public health measures. And when they do, and when individuals do, there's less risk. Is there no risk? I can't say that. But certainly, I think we can make it as safe as possible as long as people follow all of the public health measures.
Okay. I think that's everything for me. Thank you so much, Dr. Salvatierra.
You're welcome.
Thank you, Taylor. Okay, we've got Trent Radio on the line. Is that Rob? Do you have any questions for us?
Hi, yes, it is. Thanks, Brittany. I just have two quick questions, I guess, about clarification. The first one regarding the gathering or the party at Severn Court. If there's 200 close contacts, does that mean that there was a party with 200 people, or is that in I guess it's about a week since that would have happened, there's been 200 contacts both then and later?
Right, more the latter. You have to understand that these students share residences, so they can be up to 6 students per unit. So if you had one person who attended the party or one person who becomes a case, all of their roommates become high-risk contacts.
Okay, perfect. Thank you. Then my other question is about the attestation requirement, I guess the new order for restaurants. Is that a written attestation that patrons are required to make?
Yes, so we have provided our food premises with a new template where people, because they have to record the names and contact information of people, and they have to do screening, make sure people are not sick when they enter the premise. This form actually captures that information. In addition, provides the diner with an opportunity to attest that everyone at the table is in the same household. So we are holding the diner accountable, and hope to do, we will be speaking with our enforcement partners on Friday to determine how best to monitor and enforce.
Okay, perfect. That was going to be my next question is what are the steps after that? So I guess we'll learn more soon. Perfect. Thanks so much. That's everything from me.
Okay, thank you, Rob. So we have a few minutes left with Dr. Salvatierra before she must dash off to her next meeting. So Dave Feely, you had another question?
Hi, very quickly. You'd mentioned earlier that the vaccines are starting to roll out in retirement residences. Will that be extending to staff? I think you said it was. And will it be extending to the essential caregivers that are involved in those homes?
Yes, yes to both.
Okay, thank you very much.
Okay, thank you. Matt Latour, if you've got another question, go ahead.
Yeah, we saw an Instagram post earlier today from a local restaurant that's quite unhappy with some of the new rules that are being put in place at the end of this week, saying that restaurants are kind of maybe taking a lot of the blame for this because some people aren't listening. Do you have a message for any restaurant owners that may be upset or angered about these new rules?
Well, I share their concern, Matt. I don't think it should be all on their shoulders to bear. I think individuals need to take responsibility, which is why we are doing a public education campaign so that we're not putting all of the burden on our food premises. We're asking people to take the measures they need, not to go out unless they are only with their household members, so that when they get to the restaurant and they fill out the template, which we have provided to all the food premises, they can honestly attest that they are only with their household members. So this is only going to work if people take it seriously and follow the instructions. So my instructions do include, do go out to the individual as well. And as individuals, you will be accountable and responsible. And if you are found to be not in compliance with the regulation, you will be charged.
Perfect. Thank you.
Okay, thank you. I think that wraps us up for today, and I know you have to go, Dr. Salvatierra. So again, I would just like to thank our media partners for their help in getting the information on. Go ahead if you need to sign off, Dr. Salvatierra. And we will follow up with everyone again on Thursday for our regular media briefing. And with that, I would like to also just again thank our many partners who are helping us contain the outbreak: Fleming College, Trent University, the Severn Court Property Management and paramedics for their swift action to date to help us with that. So we will see you back here on Thursday for our regular weekly briefing. And with that, please stay safe out there. And if you have any other questions, just feel free to email me. Thanks now.
Thank you.
Thanks, Brittany.
All the best, Brittany. Bye-bye.